A new app developed by a Yorkshire company and being trialled in Leeds is helping people to manage chronic pain using their smartphone or tablet. It's supported by NHS England and is now due to be rolled out in other regions. The app is currently available to more than 7,000 patients, making it the largest digital health service to be commissioned in the UK. Now, in a moment, we'll be talking to a physiotherapist who helped to develop it. But first, Heidi Tomlinson has this report.
Yeah, that's right.
A weekly yoga class helps Maggie Popper deal with severe backache. It's one of the tips from a new chronic pain app she's been testing for the NHS.
That's where my main pain is, but then I have some radiating pain that comes out of that. The first step on it is accept the pain. You know you've got it. I know it's not going to change, and it recommends all sorts of things such as pacing yourself, stretching, exercising.
And so the person with persistent pain can just mark the areas of pain.
Patients record the intensity of pain and which part of the body's most affected. The format's been developed by a company in Saltaire, trialled in Leeds, and is now to be used by the NHS in other regions.
It saves time for the patient. It means that information can be sent to the healthcare professional without having to traipse into a GP surgery or into a clinic. And for the healthcare professional, it means that information, most up-to-date and accurate information, is available digitally attached to the health record.
Some of it will come through as a graph form, some of it will come through in the form of answers to questions, and that information is really helpful because we can find out exactly what's been important to the patient and what we really need to focus on when the patient comes into the consultation with us.
Tool 5. Setting goals and action plans.
Maggie's been testing the app. It offers up advice in response to the pain scores she inputs.
Last week I did get a score that was a little bit lower than the week before, and so it referred me back, and straight away I thought, no, I haven't been paying enough attention to that particular area.
PainSense is designed to work alongside face-to-face appointments. The theory is when Maggie does have a consultation, her doctor is armed with much more information, which could make treatment more effective.
Okay, thanks very much.
Heidi Tomlinson, BBC Look North, Leeds.
Let's talk now to Simon Ball, who's a physiotherapist who's been involved in developing the new pain app. Just tell me a bit more about your role in all of this, Simon.
So, being a physiotherapist by background, I try and keep the clinical focus for the app so it doesn't become too technological, and it maintains that clinical patient focus, what the clinicians want, what the patients want.
I suppose if I were in pain, I really would want to speak to a doctor, though, about it, not an app. I mean, how do you justify what you're trying to do here?
It's not designed to take away from the one-to-one consultation. It never will. But it's designed to allow patients to fill information at home, make it a patient-focused appointment when they eventually do see a clinician, and allow them to get their point across prior to the appointment so they can prepare for the appointment's more efficient, the clinician knows how they're progressing with the assessments and the outcome measures that are used on it.
I suppose the other side of it as well is that it could save an awful lot of money as far as the NHS budget is concerned. Is that part and parcel of what you're trying to do as well?
No, it's designed to try and make the patient the focus of treatment. So a lot of the time the medical model is very much maybe prescribing medications or prescribing services, whereas this is designed to listen to the patient, what does the patient actually want, and it can tell the clinicians how to design a bespoke service for that patient.
I suppose if you look into the future, you know, this has got tremendous potential, hasn't it? Where do you see this going in 2, 3, 4 years' time, Simon?
Digital health is at the forefront of healthcare, with the technology that is now available for everybody. Sky's the limit, really, which hopefully PainSense as a brand will continue to develop and be involved with many services throughout the UK.
Just very quickly, what kind of reaction have you had so far then?
Really positive. Patients like Maggie really like being able to tell their story before they get to see the clinician.
Okay, Simon, thank you very much indeed for joining us this evening.